So understanding that we do have limited resources, what are we doing as an organization to kind of curb this issue?
Yeah. So, I mean, resources is one issue. It's like I've spoken about before, the stigma about actually accessing care, health-seeking behavior. And from a health industry perspective, we really need to take this seriously and see what we can do to solve the problems of those lives that we are trying to support. So where we looked at supporting mental health is really going a digital way. It's a lot more accessible for people, and it also helps them to gauge or to interact with solutions that they are most comfortable with. So we have our AfroCentric mobile platform, AMP, and we've partnered with a mental health app called Panda, South African-based company. And within that solution, we have really tried to target all those barriers to accessing care. So it's barriers of affordability, because we know cost is always going to be a challenge in our environment. Physical access is another thing. We spoke about the limited resources, but also giving people the opportunity to speak to someone in the privacy of their own home. And so the solutions that are available on this digitally enabled platform is being able to speak to someone as in a virtual consultation. They would have access to group sessions with peers. That often works better for some people than others, where you can speak to a group of people who are going through the same thing that you are going through. But if you aren't yet at that stage to speak to someone or to share your experience, there's a lot of educational material that can give you pointers and tips of how to deal with it, how to start conversations, to get it to that point where you feel a lot more comfortable to take this journey to better mental health.
I think if I can add to that, I mean, I think I'm glad you raised that point as far as access to healthcare professionals. There are a lot of healthcare professionals out there that can support, and maybe people just don't know about it. You know, a GP is a fantastic place to start. And you've mentioned about enabling virtual consultations, enabling digital care, enabling access to the GPs is really important. Another thing that we are doing from an AfroCentric Medscheme perspective is actually assisting in upskilling general practitioners on how to manage mental health. It's a huge issue out there, but remember, GPs are really busy. They're dealing with from A to Z of a gamut of conditions, and they've got like 10, 15 minutes to see a patient because there just are not enough doctors out there. So what we're doing is we are running programs and courses so that general practitioners that are interested in being more involved in mental health, on how to identify common conditions, how to diagnose them, how to manage them, how to maintain them, how to follow up with their patients. And also more important, well, not more importantly, but just as important is how do they work with that whole mental health team? So you get this whole clinical care coordination system within the multidisciplinary team. When do they need to go see a psychiatrist? When do they need to go see a psychologist? When are they potentially at a risk to themselves or someone else? So I think that's an important part of it, which I think Litha would probably want to comment on that as well.
Yes, thanks, Wayne. I think we've really, as AfroCentric, worked very hard and closely with the societies, the psychiatrists, the psychologists, the physios, OTs, the GPs, just the whole multidisciplinary team that's involved in mental health. And listening to them, we've really enhanced benefits that members have and can access, especially out of hospital. The biggest challenge that we had in the past was just limited benefits that members have access to out of hospital. But that's now a foregone conclusion. We've dealt with that, and our clients have got richer benefits, and psychiatrists are loving it, and the other professionals are now starting to come on board. So members can be effectively treated out of hospital without necessarily being admitted. Only the very high risk or the very sick will need an admission, and then after discharge, they are still followed up with better benefits out of hospital. And we've done that successfully now with the societies.
Yeah, and I think, from what we're discussing here is that, if you want help with your mental health, it's not just about going to a specific professional. It's taking that first step, whether it's self-care, whether it's going to your GP, speaking to a family member. The support is there. And once you've gotten the support, you could then be assisted through these interventions to navigate that support system. And I think that's maybe a big takeaway for everyone, is that, the first step is to look after yourself and speak to someone. And
if I may add, identifying that you may actually have an issue.
Yeah.
Because some people don't actually realize, and that's why those tools, as you've mentioned, that we've put in place, where people can actually use clinically based, validated tools that are supported by the mental health practitioners within this country, on actually understanding, well, do I have a problem and how can I manage it and it'll be okay? Or do I have a problem maybe that's not going to be managed, and do I go further in seeking advice? And I think that's really, really important. It's all about taking ownership and identifying in oneself.
And I think in this area, patience from those around you, and patience with yourself, but patience from those around you is important. And people not trying to counter your symptoms. So you feeling a certain way, or there's a certain symptom, and it's just like, it's a quick fix, let me do this. So I think there's a role as well that, as you've all said, that even the family members and support, help. So I think this is an area, and I suppose in any area in medicine where there is this app, I'm using it, but also my family should use it to upskill themselves in that information. So not just me as the patient must understand. And it's available, right? So if you have it, my family can also, kind of access it and actually read what is offered.
It's actually raised a very interesting point, because it's not only for people that suspect they may have a mental health issue. It's actually for everyone. It's for all of us sitting at this table on what can we do to actually prevent ourselves from going into the situation. Prevention being an ounce of prevention worth a pound of cure, as they say. So it actually functions from that point of view of actually keeping your mental health healthy.
Look, I think you've touched on a very important point there, Wayne. I think firstly, we need to recognize as a society that mental illness should not necessarily be looked as a mental illness as if we are gone cuckoos. It's brain health. It's all perhaps something gone wrong with your brain, just like people have heart health issues, skin health, kidney issues, you know what I mean? People talk about heart health, skin health, and so forth. So we need to start talking about brain health. And now if there is a brain health, there are ways to manage that. And I think there's a lot of free material available. On our Medscheme website, we've got a free resource hub where members or anyone not necessarily registered to our schemes can go into it on www.medscheme.co.za. There's lots of information available. There's also South African Depression Anxiety Group. They have a lot of information on mental health, from depression, anxiety, substance abuse. And people can go and find these resources. It will teach them a lot about what signs to look out for and how they can start getting the necessary help before even consulting a GP or a psychologist. So there's lots of information available out there.
So I hope that from this discussion, you've sparked a number of discussions out there for those who are watching. I think that is the first important step that people need to take when thinking about their mental health and the mental health of those around them. And hopefully we'll have more engagements in the future where we can support South Africa better.
Absolutely.